My name's Jenny. I'm a physiotherapist. I work as a first contact practitioner for the NHS. So that basically means is I work as a physiotherapist in GP practices to take some of the load off the cases and all the patients that the GPs have to see from a more musculoskeletal point of view.
All right, thanks for giving such a quick overview of what you do. And the point really today is to learn more about your experience with the NHS in terms of employee communications. And the question I have for you today is, can you tell us about any initiative that you've seen around giving employees a voice?
Absolutely. I've seen quite a few initiatives, in the past sort of 6-7 months that I've been working for the NHS with regards to sort of focusing on sort of touching base with different NHS workers, making sure that, they're being heard, their mental health is doing okay. For example, oftentimes we're so busy of seeing patients and you're worrying about other people and the patient load is so much and you're trying to get to everything that sometimes it feels like NHS, the people that work there are being forgotten. So I think in the last sort of 6 months, I've seen a lot more sort of sending out invites and organizing sort of social events to have a bit of a debrief for people that work, especially where I work in sort of primary healthcare. So we work sort of the first level of healthcare for patients before they even go to hospital or see a specialist or anything like that. We see sort of the most basics of the basic, and it can get quite intense and quite demanding. So it's nice. The NHS does a lot of effort to try and include us in sort of social events and sort of debriefing events to try and take off some of that stress that we experience as well.
And do you feel like that had an impact on the way you work? Do you feel like being valued and included in these events had an impact on the way you deal with patients, for example?
Absolutely. I think, you trying to give health and care to somebody else. I think before you can do that, you need to make sure that you're looking after yourself as well, and that if you're coming from a space, you're tired, you haven't slept enough, you're under pressure, you're stressed, the type of quality treatment that you're going to give your patients is going to lack. So I feel like it's really important, and it helps a lot to have this, these sort of events and things, because then you can just, your productivity and your sort of picking up on certain red flags or certain conditions that are seen as more serious becomes sharper, because you're not stressed, you're not tired, your thinking's clearer. So it definitely helps in the long run for productivity.
Nice. One last question I have, because I don't want to ask you too many questions. You mentioned in the last 6 months, you've seen this happen. What do you wish to see more of moving forward?
I think, it is very good as far, the last 6 months that I've seen. I think since sort of the pandemic situation, it's been brought to more people's attentions the importance of your sort of frontline workers and your healthcare workers and things like that. I think pre-pandemic, people always knew about it, but only, once you were sick and once you were part of that, once you were needing to see somebody like that. But I think since after the pandemic, people have been made more aware of the importance of your sort of frontline workers and your healthcare workers. And so seeing sort of for the future, I like to see it be, the sort of attention or sort of care and effort that's going into like making sure your healthcare workers are looked after remains in play even after we're sort of moving out of that pandemic stage. We're sort of going back to normal. I hope to see that doesn't just fall away and disappear and we all just go back towards the rat race.